Hi there, this is Dr. Ritamarie Loscalzo, and I'm here today to talk about a topic that is of great interest to me. It's biochemical individuality. So let me start by defining what biochemical individuality actually is. We are each born with a set of genes and a set of chemicals in our body based on the environment we were in when we were in the womb, the environment that our mother subjected us to or protected us from when we were in the womb, her diet, her genetics, and it all goes in to make up who we are. And we know when we look at people, you look at two humans, we know that they're in the category of humans because we all have the head and the two eyes and the arms and the legs and all that. But we don't, no two humans look alike. Even identical twins don't look exactly alike, and they're from the same genetic pool. So we all look a little bit different on the outside, even though we have this basic similarity. And I believe that that's true on the inside as well. We all have this basic same similar structure, an intestine and a stomach and neurotransmitters and immune globulins and things like that. We all have those things, but we have them in different proportions to each other, slight. We might have them, the intestines might be of different lengths, they may be twisted in different ways. The same way as noses are shaped differently on the outside, intestines may be shaped differently on the inside. Stomachs might be shaped differently on the inside. The little receptors that receive neurochemicals might be slightly different shaped, which allows one to receive the chemicals and take all of it and have an abundance, and another one to be a little bit shy and not reach out and grab quite so much, and that person doesn't have quite the robustness of neurochemistry. So this week has been really pivotal week in natural health, and there's been something called the Great Debate that's been going on, led by Kevin Gianni, and he's brought together different experts, but very specifically chosen experts that had differing points of view in a certain area. Not that they were completely opposed to each other, because what we found as we listened is that there's so much similarity between what everyone's saying, but that they had slightly different approaches to a particular aspect of health. Let me give you an example. They had two people on, Dr. Gabriel Cousins and Dr. Joe Mercola, both big names in natural healing, well-known, very effective. They've had very good results working with people, but they have a slightly different approach. They both believe that all your food should be whole, it shouldn't be processed, a high percentage of it should be raw, but one has the feeling that animal products should not be part of that, they should be excluded completely, and that the food should be all uncooked. And then the other has the opinion that animal products should and can be an important part. But where they came together, though, was the concept of biochemical individuality, that for some people animal products might be necessary, and for other people animal products are completely contrary to good health. And what's important is that the individual figure out for themselves what works and what doesn't, rather than dogmatically following what I like to call one of the food religions. And like anything else, and we can get into my opinions about religion too, but every religion holds a piece of the truth. Every food religion holds a piece of the truth. And the basic premise is that we all a little bit different. And that's how I approach my patients when I'm working with them, is to look at what are they doing, what's working, and how can we fine-tune that? And we look at signs and symptoms on their own bodies to say whether it's working or not. We look at their lab work, their blood work, to see if they're well-nourished and they have all the robustness of neurochemistry and hormones and enzymes that they need. So biochemical individuality is very, very important, and I would really encourage you to take a look at those great debates, because there's so much information there, and I've been doing this for 25 years. I've got pretty strong opinions about what works for me, and as I'm listening, it allowed me to open up to some of the dogma that maybe I was living by, that this is always bad or this is always good, and see that there is no black and white. There's certain things that are pretty black and white. Smoking is pretty deleterious to your health. Processed foods, hydrogenated fats, refined flours, sugar, fructose, high fructose corn syrup. We would all agree, at least all of us who are more on an alternative natural bent, that those things are harmful, and there's scientific evidence, and there's cultural evidence, and there's clinical evidence that those things are harmful. But what about the little nuances? Like, is all meat bad? Yeah, hot dogs and hamburgers and Spam are probably the epitome of poor quality meat, factory farm meat that's loaded with antibiotics and pesticide residues, and animals that have been inhumanely treated, and then their chemistry that gets translated into their blood when you eat it is of fear and stress. And so that's probably, pretty much, we can agree that that's not good. But what about those humanely treated animals that are, raised well, or in the wild, and still have a plethora of good nutrition in them? Are those harmful? Are they good for you? Or are they maybe just one of those in-between foods that are neither harmful or good, that you can exclude or not exclude from your diet and still be able to maintain the robustness of your health? What I would say is just about everybody on that panel, I would say everybody on that panel agreed. Greens are one of your most important nutrients. Green leafy vegetables, cruciferous vegetables, your kale, your romaine lettuce, broccoli, cauliflower, cabbages, all those foods fall into that category of highly nutritious and very much should be a part of everyone's life. Should it be raw? Should it be cooked is another issue that comes up. And some believe that in order to get the full nutrition out of the food, it needs to be cooked, while others say that, well, when you cook it, you destroy the nutrition, which is true. Well, I think both can be true. There are certain nutrients that may be not released as well when they're eaten raw because they're locked in the cell wall. And as a long-term raw food enthusiast, I know of techniques that help you to release those. But for some people, eating some cooked vegetables is a really important part of their diet because they can get a plethora of nutrients, and the little bit of nutrient degradation is not that bad. But where does that lie? Well, what is it about you? What about you? What about the high fat versus high fruit controversy? Like, fruit is great food. It's loaded with nutrition. It's loaded with antioxidants. On this side is fruit is bad. It's loaded with sugar. It acidifies your body. You should never eat it. Well, when you look at nature, nature gave us those fruits. Maybe we've tampered with nature a little bit too much and we've hybridized them so that they are higher in sweet. But I think, again, you've got to find out for you. If you eat fruits and you get this off kind of feeling and your blood sugars start to fluctuate, you're not in a position at this point in time of being able to do fruit. If somebody says, well, get rid of all the fruit and fill in your calories with fat, but you've got a compromised liver, the fats aren't going to do you any good. You're going to eat the fats and you're going to get gassy and bloated and break out and have all sorts of problems with the fat. So the truth lies in really being tuned into who you are right now, not necessarily who you are going to be, but what's the state of your biochemistry right now? What's the absolute best foods right now? Do you need cleansing foods? Do you need more grounding foods? Do you need just more calories? And then making those choices within the realm of the foods that we would agree are good for us. And we all agree, all of the experts out there and people who are working with natural health agree that the foods should be unprocessed, that they should be whole, as close to nature as possible, as close to freshly picked or freshly killed if you're doing animals as possible, that the processed foods that we're eating, the homogenized dairy loaded with bovine growth hormone, not good for you. Maybe raw cultured dairy is not a problem, but it's all about finding what works for you. And I'm dedicated my life to helping people with that. I even teach a class called Assess Your Own Body that teaches people how to analyze your own body symptoms and your own body markings and your own blood work so that you can help to determine what exactly is the right diet, lifestyle, exercise program for you. So take that away. Really, really sit, listen to the great debates, see what resonates for you, but don't just take someone's word for it. Go out and use the absolute best scientific experiment ground you can, which is your own body. Eat, try, observe, get yourself tested, work with a practitioner who knows what they're doing and who really can accept you for where you are, is not going to throw dogma down your throat, and you're going to be able to be as healthy and vibrant and energetic and fit as you choose. So thank you very much. This is Dr. Ritamarie Loscalzo. Go out and have a really fit, fine, wonderful day.